SRHR. When I take a number of norms to do with marriage, I think girls from a young age are prepared for marriage. So whenever they're growing, they know at some point they're expected to get married and they're being prepared for that. And this also is increasing issues of child marriages, which is also one of the key issues when it comes to sexual and reproductive health. Aside that, there are a lot of expectations that the society has to our adolescent girls and young women, particularly in terms of maybe being subordinate to male because of the maybe ask a hand in marriage to ask a man into a relationship. So they are limited to choices, even in choosing, selecting the partner, because most of them are shy to maybe ask the person that they like, and they end up being with abusive men or boyfriends. But aside that, we have tried our best also to use the gender transformative approaches, which helps to give the young people as well as different communities to be able to reflect and question some of these norms and gender norms. So we use approaches like the gender box, where we engage in discussions with the young people to be able to write down what the society expects as a woman to do and as a man, so they're able to reflect and start to question, why is it that the society wants us to get married and such kind of things, which also help to transform the negative perceptions and also the negative norms that limits girls' decision-making power. And for me, it's the issue of the power dynamics that is there between men and girls. So we really need to do a lot in utilizing this transformative approach to transform these negative norms and at different levels, because they have a connecting barriers. For example, at the individual level, using the socio-ecological model, where decisions at the individual level has a connotation or direct impact to the community and to the policies. That's why we're seeing that the policies are not being effective, because they're being formulated by people who have the same rigid social norms, gender norms that have grown up all their life believing that they're normal things. So this is one of the barriers, but also we need to utilize this approach to help them reflect and question some of these issues, but also address the power imbalances.
Thank you so much. I hope that was a clear takeaway that indeed, as you address some of the negative norms, a model such as gender transformative is very appropriate in enabling communities to counter the negative norms that inhibit access to sexual reproductive health and rights services. Thank you so much, Yo. We move on to Daniel Watenga. Can you share initiatives that your organization or indeed your country has implemented for adolescents and young people? What has made it so effective, and how can it be replicated in other contexts?
Thank you very much, moderator. Before I diverge into that, you allow me 5 seconds to actually share a story, a personal story.
Provided you're within 5 minutes.
Yeah, I'll keep within that. So in February 2010, there was a landslide in Uruda. This landslide left very many families displaced, and about 500 people died. I got a new friend called Veronica back home, and this was a 17-year-old, very vibrant with a future, wanted to become a very powerful woman. 6 months into neighborhood, she's married off by her father because the father wanted to buy new lands. And 6 months later, she dies of complication of unsafe abortion. And Veronica, like very many other girls in the region, face these challenges. And today, this is part of something that we are discussing today about. So yesterday and today, we have had a deeper discussion about the contextual issues, the challenges across the region. But something we have left out that is very crucial is the issue of climate change that is affecting us. But I don't know about other parts of the region, but Uganda particularly is highly affected by climate change. And over time, we've seen that climate change directly affects sexual reproductive and right as a cross-cutting issue, not leaving aside gender inequality. So I wanted to factor in that as one of the issues that are affecting access to information services around sexual reproductive health. In regards to what the country has done and what FIC has done as an organization, I would start with what the country has done, particularly the Ministry of Health. So Ministry of Health has put together very good ideas that could actually work. But at some point, we feel there's still a gap. Some of these have been district committees on adolescent health, DAICA, that have been initiated. That this district committee will oversee implementation of adolescent health services at the sub-region, sub-national level that has been implemented. But also government has a digital platform where young people are able to access information through SMS and toll-free call center. That personally I have worked in the call center in year 2022, 2023. The minister has also had decentralization of initiatives at district level, but also has done what we call a vulnerability assessment analysis and developed an HNAP, Health National Adaptive Plan. This is in regards to climate change. So, and this is something that I feel should be replicated in other countries within the region, developing a national adaptive plan towards climate change. As an organization, in our programming around sexual reproductive, we were very ardent in doing having a holistic approach. And our program has an approach, particularly the project that we are implementing around sexual reproductive health is called Empowering Adolescents for Sustainable Sexual Reproductive Health, with an approach called a biostructure social approach. A biostructure social approach looks at the biomedical approach, the structural approach, and the social approach. That if you're talking of young people, you need to, because of the challenges that we have highlighted, you need to have a multifaceted approach. That you are looking at getting the information to the young people about their reproductive anatomy, about their sexuality, about about sexually transmitted diseases. But also you are supposed to develop the structural support system around them through linkages, through policies, through capacity strengthening of health system. But also at the community level, you need to that's where the social aspect comes in. You need to engage the community to understand that, look, this young person has something to learn. So that's something that we are bringing on board. And at the regional level, there's an initiative back home that we are pushing for that seeks to speak to regionalization of impact. And that is a coalition. And maybe given time in a few seconds, in the next discussion, I'm going to say something about that. Thank you very much.
Thank you so much. I really hope as the audience, we are really taking note. I think very profound strategies coming out. And remember, he points out a very important issue around climate and how we can't leave it behind in programming for sexual reproductive health. I'll move on to Miranda Ziba. Miranda, how have you engaged with policymakers to advocate for improved SRHR policies in Zambia? Can you share any successes or lessons learned from these advocacy efforts?
Thank you very much. Like I mentioned in my bio, I've had a privilege to sit in most of these key decision-making spaces where I get to interact with policymakers and ensure that I push the agenda of increasing access to sexual reproductive health services for adolescents. Some of these interventions I have taken in advocating for access to sexual reproductive health has been developing policy briefs that inform the policymakers on the issues that are affecting adolescents and young people. I've also been part of committees that have been called upon to contribute to the development of guidelines and policies like the adolescent health policy that speak to access to sexual reproductive health services for adolescents and young people. So I'll just jump to the successes because I mean most of the engagements are engagements like the one we are currently having, where we have the members of parliament. I've had interactions with the Minister of Health, and through my organization, we managed to get funding to fund us to implement regional adolescent health endeavors. And apart from just implementing the endeavors at a regional level, we've been able to implement that at district level through funding which we got direct from the ministry to allow us to go into the deep-rooted rural areas to reach out to those adolescents who have been marginalized. That is one of the successes we got through our advocacy. We've also had a success in our country in terms of rephrasing the term age of consent. It has now been rephrased to age of access, where now the ministry is working on developing guidelines that are going to support access to sexual reproductive health for those that are unable to get consent from their parents. We've also had, I also had an opportunity to participate in the PEPFAR COP23 development, that is the country operation plan. And during that meeting, I was part of the team that advocated for an innovation fund that is going to support youth innovation. And that was a success. We managed to get funding as a country, Zambia, among the 5 countries that were selected in Eastern and Southern Africa. Zambia was among the 5 countries that is receiving this funding, and this is something that was just developed right after the COP, and we got commitment from the ambassador, and he managed to ensure that he implements that. We kept following up, and now we are recipients of that funding. We've also been able to get commitments from policymakers, like it was mentioned in the documentary that was shared yesterday, where our minister had made a commitment to be part of the team that is going to push for the reduction of age of consent and speak to ensuring that we have guidelines that support access to sexual reproductive health services. I'll go to the local level. I think that was a bit too high level. Locally, I have used my advocacy skills to influence health facilities in how they implement their service provision. I'll talk about a certain approach that we have used, which is called interface meetings, where we've allowed adolescents to come and sit down with the healthcare providers, present their challenges, and be able to come up with an action plan at the end of the discussion on how they are going to address these issues with their healthcare providers. So with funding, for example, with funding from HIVOS, we were able to implement weekend clinics with the healthcare providers, because this was a recommendation from adolescents that they want to access the services over the weekend as they can't access them during the week when they're in school. So these facilities were able to implement these clinics with us, and they continued post the project. So this is sustainability we're speaking to, and they were able to continue implementing. And even as we speak now, they're still pushing that agenda and requesting for funds from any possible donors that are able to support such initiatives. And this is something we have seen to be working, as most adolescents are now accessing services. You spoke to some of the lessons that I think I have learned throughout this process. And some of these lessons include the fact that policy change is actually something that is usually very slow, and it requires a lot of persistence as you advocate for this and engage with different people. I think the member of parliament actually mentioned that sometimes you find that once the director you were pushing an issue with leaves, then it's like you're starting over. But I learned never to give up, but to keep on pushing. Excuse me. I also learned that we need to ensure that we leverage on involving the grassroots. Like I mentioned, I ensure that in my advocacy efforts, I involved those within the health facility, the ones that are actually providing the services. So as they're improvising and getting those innovations and implementing them, we will find a situation where at the end of the day, it will reach the ministry and they will think it's really necessary for them to continue providing services for adolescents, maybe over the weekend. Right now, as we speak in our country, we have separate days that have been created for young people to be able to access services, separate, away from everyone, away from other people, and on the separate days where nobody is able to know that they are going to access, let's say, contraceptives. So that is something that I've seen to be working. I've also learned that the approach you take in advocating matters. I know we as young people want to go out there and use all sorts of advocacy strategies, but I have seen one advocacy strategy that has really worked for me and my organization, which is dialogue, ensuring that we come and sit with these policymakers, ensure that we make them understand why we are requesting for certain changes, and we inform them about what our recommendations are in a good manner. And we find that most of these policymakers tend to understand why we really need this. Going back to grassroots also, I have learned that in our processes as we are implementing our advocacy efforts and pushing for certain changes in policy, we are leaving out certain key players in these policies. And these key players include the parents. Today we are talking about age of consent. And I don't think, or I don't know if we have deliberately just picked some members of the community in our efforts to reduce age of consent, like the parents and guardians to these children, where the children have to go and get the consent. I don't think we have done much around engaging parents, because these policymakers will go back to their constituencies, Ministry of Health will go back to the parents and guardians, and they will want to get recommendations from them on what they think would be the appropriate age, for example, or whether they think it's okay for the age to be reduced. But then those people there will just say, no, they don't think it's right. Thank you. They'll say it's not, they don't think it's right for a young person to access services. And we have been here pushing. Some of us have flown from our countries to come here, and we are pushing for this agenda. But when we go back to the parents, they'll say no, and that will be worked down is almost zero. So I think there's something more that we need to do. Thank you.
Thank you so much, Miranda, for taking us through the policy influence at a regional level and indeed at a local level. A lot of strategies to take away. And she's also re-echoed what the Honorable said in the morning about never giving up, especially that as individuals in these high positions, our values are not reconciled and we have a lot of bias towards a lot of issues. So we still have a lot of work to do, really. I'll move on to Diana. Since you are part of the Access Task Force, what have been some of the opportunities for collaboration to enhance SRHR service delivery in Zimbabwe?
Thank you so much, and I'm glad you asked that question, starting with the Access Task Force. And for some of you who may not be familiar, what we did in Zimbabwe is, you know how obviously as you're working within a movement, you often find that there's a lot of you who are pushing exactly the same issues, and we are happy as a movement to be pushing individually, and everyone has their work plan and when they do things and so on. But we realized it wasn't working in the Zimbabwean context. So what we did is we called everyone we knew had anything to do with age restrictions in their work plan. Everyone we knew. Put everyone in the room and said, guys, we need to push on age restrictions. But guess what? What we have been doing up until this point is not working. We need to work together. All right, guys, what needs to happen? Yeah, of course the law needs to change. Yeah, of course we know that. But how do we get to the legal changes? Okay, we need the parliamentarians to understand what the law actually says. Okay, let's come up with what we were calling at the time the master plan. We want to sensitize parliamentarians. We want the young people to be able to speak to the issues of access and have the same voice. We need to have an agreed position to speak to. When we are asked what needs to change, I should be able to say it in 2 minutes. It doesn't matter which young person you get. It must be the same message. So we came up with this Access Task Force that brought together all the youth organizations and CSOs that were working on access-related issues. Then we came up with the master plan. Guys, these are the things we need to do until we get to our win, which was the legal change. And we actually then started saying, okay, what comparative advantage does each organization have? I work with Parliament already. I understand parliamentary processes already. So we don't need to get anyone else. I'm already the parliament person. Okay, cool. What do you do? Oh, actually, we work a lot with the ministry. Ah, great. So you're the comparative advantage. Every time we want to engage the Ministry of Health, you are the point person. Okay, what do you guys do? Oh, we work with media. Great. So you are our media point person. But what it also then helped us with is if I'm already working with media, I already know how to navigate media. I already know who's influential in media. I already know what kind of framing I need to do. Same thing, if I'm working with parliament, the way I frame a conversation with parliamentarians is not the same way I will frame it with parents. And so we actually did that with all of the Access Task Force members. Whatever you already had an advantage in is literally what we put you up as a responsibility on the master plan. And what it also meant was every time the minister's door was knocked on, you already knew what the message was because it was always the same individual. But guess what? It was not the presentation that this individual is making on their own. We were meeting regularly, we were putting together our messages. Okay, we're going to the minister. What has happened recently? Oh, we've renewed our ICPD commitments. Okay, so part of our conversation is to speak to that. Oh yes, Parliament is currently going through a lot of legal alignments right now. We need to put the language around legal alignments. And the more we do this, the more it started to look like maybe some donor from somewhere had come in and poured money into the campaign. It was exactly still the same amount of money, very limited as it was. But the amplification of just coming together as the Access Task Force meant that every dollar gave us results. Every meeting had an intention, had an objective, had an outcome, had a follow-up. So whatever we could do as individual organizations over a 2-year period, all of a sudden we could do it in a month. Every parliamentarian, whenever they would see us, would start talking about access. Why? Because every time we saw them, we forgot to talk about water, we forgot to talk about housing, we forgot to talk about education. We literally just said, we are talking about nothing else except. And that's what we talked about. Even if I was asked a question about water, you know the problem with water is that it starts with access to SRH services. We would link everything, guys, even if there's a budget consultation. Oh yeah, we want to know more about the budget. Yeah, but then if you don't put money, it will affect the access to SRH services. Oh yeah, we're talking about climate change. Yeah, of course, because access to SRH services. Oh, today we're talking about development issues. Oh yeah, but access to SRH services. And the MPs and the minister and the media started to become champions. We got to a point where we were the ones getting calls from those stakeholders. Oh, there's this engagement. Oh, there's this meeting. Oh, we are going to South Africa and I need to go and present on this. Can you help me with the presentation? Where now, even the parliamentarians themselves, what they are speaking to in international and regional spaces is directly coming from the Access Task Force. And that can only be achieved by recognizing what it is that we already have. And even as we were doing this, we also started to see that I know a lot of people were talking about how we are leaving a lot of stakeholders behind. The reason they remain behind is because of our siloed approach. So I need to engage with the MPs, yeah, and he's also engaging the MPs, and he's also engaging the MPs, but no one is engaging the parents. But then the more you come together and do the collaborations, the more you're able to start seeing, okay, I think we have a gap. Yes, we've engaged media. Yes, we've engaged the young people. Yes, we've engaged the MPs. Yes, we've engaged the minister. But every time we go to public hearings, there's such a resistance. And I think 3 or so years into our campaign, we realized we needed to bring in the church. Because they were the ones that were actively mobilizing against us. So we said, how about we sit down with church? Again, we can't talk to church the same way we talk to MPs. We can't talk to them the same way we talk to media. It means we have to change our approach. We sit down with the church and then we start saying, we agree with you. Young people should not be having sex. We agree with you. Morality is up there. We need to make sure that we ensure morality. But just like in the Bible, when one has sinned, there must be a redemption process. What does that look like in health terms? And now all of a sudden you start hearing people say, oh yes, so yes, we need abstinence messaging. Yes, we need to make sure that we tell them not to engage. But once they've already engaged, I think they might need service. And then rhetoric starts changing. But it is a lot of work. It's something that not one person can do. And guess what? SD, I don't have to be in every meeting because it's not my strength. When we are meeting with church members, there's a group of people that we know are going to be specializing with engaging with church. They learn the language, they learn the Bible, they learn the Quran, whatever we need to use. If it's an academic space, same thing. So I think it's one of those things that we need to do. And I know a lot of young people already have a lot of capacities that they have. The question is, how are we going to make sure that those capacities work in our favor? We got to a point where we had bothered Parliament enough until they said, hold on, can you now bring us a petition that we can respond to? How many of us have submitted a petition when Parliament is already expecting it? A lot of us are seated in our offices. We need to write a petition. We need to demand. They have no idea and no understanding of the issues that you are petitioning. So make sure they understand the issues first, then petition. That way, they already understand what the issues are. From a technical point of view, they might know what they need to do. I can guarantee you every parliamentarian in this room will tell you, in terms of the work that I need to do, from a technical point of view, I know it. But sometimes it's the issues that they don't understand. It's the impact that they may sometimes not understand. But of course, it was not without any challenges and hiccups as part of that. But I think us being able to meet on a regular basis meant all of the challenges that we faced, we could respond to them by immediately putting them in our work plan. So we would usually plan for a quarter, we meet up after a quarter, what has worked, what hasn't worked, let's change that. For example, we had a number of issues where our message was misrepresented either in media or by church groups and so on. And we needed to immediately say, no, this is not what we meant, and no, this is not what we are saying. What we are actually saying is this. So it also meant that we needed to already be anticipating those kinds of issues. But also, we realized something that I think
I'll ask you to wind up, Diana.
Maybe designed for our donors. Yes, we can put money towards engagement of MPs and engagement of ministers, but for as long as we don't have money for public support, a lot of these processes will always come to a standstill. An MP who understands the issue, but knows also that the people that voted for him do not agree with that issue, will most likely not push it forward. So I think it's something that we also need to be able to think about, to say, how do we maximize and get a lot of public support? So thank you.
Thank you so much. That was really, really useful. I think to make the most out of these discussions, please do not shy away to steal Diana for a minute or more to delve into some of the practical practices that she has highlighted. I've been blown away by the method of understanding that actually as a person you can't do it all. You really need a multi-sectoral approach. And sometimes for things to work, you have to put your logos aside. It doesn't matter who you are, where you're coming from, but you need to just identify your specialties and work towards your strength. So that was so helpful, really. I'll move on to Innocent. As RHNK, how have you strengthened collaborations between CSOs and other stakeholders to create a more unified approach to adolescent SRHR access across East Africa? And we've noted that you recently convened the RHNK conference. What were some of the key highlights from there as well? Maybe you can take those two questions. Thank you.
Thank you. Speaking after these powerful people have spoken, I think my work is going to be very easy. I'm just going to be pointing out everything. They have explained every other thing. So first of all, to the first question, how we've been able to just maneuver around this and ensure ASR is implemented effectively. I think the most important thing, which my colleague mentioned on the other side, is putting the main stakeholder on the front seat, and that is the Ministry of Health. And that has worked actually very well for us. Just getting that good buy-in with the ministry, getting the good buy-in with the legislators, it has really worked very well for us. They have been actually in the forefront of supporting us when we are convening conferences. We've had this year we had our 7th annual scientific conference on adolescent research on productive health and rights, which convened over 800 participants, and we are glad that we were able to reach out to all those participants. So the first thing I would bring out is just acknowledging and putting it on the ground and working through it, putting the Ministry of Health on the forefront is very important. The other thing is through movement buildings and partnerships, which I think Dee has talked about very well. And for us, the movement buildings, I'll speak about how it has supported us. It has supported us to just position ourselves effectively. As we're positioning ourselves effectively, we're also able to understand how are the opposition behaving. And the opposition, I'm looking at the clergy, I'm looking at culture, the community, and other people, individuals who are against our agenda. And that has really helped us to just strategically work effectively and implement our different strategies. And through movement building, we also currently we are coordinating the National Reproductive Rights Coalition of Kenya, which has brought together different organizations from the international organizations to the grassroots organizations. And we've clustered them in different clusters across the country. And it's also moving through East Africa, where we're having organizations identifying their areas of interest and strength and focusing on that. So that at the end of the year, at the end of a quarter, we're able to take note and say, Organization X has been able to implement this in this area. What has been the impact? Because that is one of the things, even when we are having a conversation with a few of my fellow young people, one of the things we talked about is the aspect of accountability. If we ourselves are not accountable to the community we are supporting, then we are not speaking anything. So that has really worked very well for us. The other thing I will speak to, is the aspect of just integration of our respective implementations. Currently, we've been working with the ministry to just ensure that we are supporting each and everything that the ministry is focused on. Like right now, we are the ones who are convening the National Coalition, Self-Care Coalition on Reproductive Health. We're the ones we have the movement that I just talked about. We are supporting the ministry to do different things. And this has really positioned us well. Every time we want the help from the ministry, anytime we want support from the legislators, they are always ready to support us. There's a friend of mine who was saying our organization has positioned itself in a way that if we call the ministry to come and support something we're doing, they will close the office for a whole week and listen and sit with us and support us. And it's actually very true. During our conference a whole week, we had the whole ministry in Mombasa and Kenya. And that was very amazing because it brought out different things which speaks to the highlights of the conference. Looking at getting the ministry to be committing to supporting each and every program and project that's geared towards accelerating health and well-being of young people, that was one of the best highlights, the best outcomes. Another thing that we realized from the conference, again, I'll speak first of all about the aspect of the youth caravan and the youth cafe. Those two things, they were co-created and co-designed by young people themselves. So just bringing together young people, we had a youth committee which coordinated the implementation and running of the conference. And it began with the youth caravan, which was both virtual and physical. For the virtual youth caravan, we had almost 500 young people across Africa joining in, asking questions, giving their opinions, and the hashtag was what you want. And you see, you listen to that hashtag, you're like, this is what will pull young people to come and just speak. Young people came to the space, they raised their issues. We documented those issues, and during the physical youth caravan, we walked for a whole day towards the conference. And along the way, we were able to just collect voices of young people within the community, listening to them, and also just letting them know about what is existing, what are their rights, what are their responsibilities, which opportunities exist for them to take advantage of. And I think that spoke to the biggest, that was like the biggest thing for the conference, because we were able to give young people the platform to share their ideas, to express themselves, to give opinions. And at the conference itself, we had young people leading in moderating sessions, young people giving, submitting abstracts and presenting abstracts on how innovative they are working in the community. And that, just looking at that, it brought about the aspect of a platform where we're having exchange of ideas, learning. Policymakers were there, we had legislators there, we had the ministry there, and this was not just in Kenya. We had legislators from different countries. I remember we had one minister from Uganda who was there, we had a minister from Ghana, and we were glad to have a partnership. Our partnership worked really well. We are glad Hivos was one of the convening partners. And you just realize that through partnership, we were able to converge, bring together a huge number of stakeholders who have an interest in sexual reproductive. And from there, people made their commitments. The ministry making its own commitments, donors making their commitments to increase funding. And also another thing that came out of that, especially from people who came from outside Kenya, most of them were like, we need to move this across the region. Now it needs to be a regional conference. And from there, we say, next year's conference in 2025, June, we are making it a regional conference because it's a largest conference. Now we want to accommodate each and every person from across the region. So the next, the 8th conference we are having, it's going to be a regional conference. We are still thinking about where to hold it, where it will be still in Kenya, or if you can come to Zimbabwe or which country, but we are looking forward to having a central place where we get as many participants as possible, as many voices as possible from the young people, because it's the young people we are working for. And if we give these young people the space, it means now we are really accountable to the young people. Thank you so much.
Thank you so much. I like it that accountability kept on coming from your submission, which reminds me of an interesting conversation I had with a number of young people yesterday on the table, where they're saying, as development practitioners, we're afraid to be held accountable by the communities that we serve, and indeed by the young people. So that's something to really take away. Are we really being accountable to young people as programmers, as organizations? Yeah, not for you to answer now, but I like that he brings it into perspective as well. And so yeah, that's a very great key takeaway. Is the audience with us? Is the audience with us? Yes. Thank you for staying with us. Lastly, but not the least, I think I do have specific questions for Miranda and Diana. But for the rest of us, I'd like us to just give us just a quick strategy that perhaps is ringing in your mind that has worked. One which you're saying, okay, I think forget everything, but if you're going to do an SRHR programming for young people, this must be it. Please, just under 2 minutes. We'll start from Yeo.
For me, the strategy that I keep on pushing it forward is the issue of transformation. When we look at SRHR to be frank, the key barriers are the cultural and religious beliefs. That's why we seem like we're not moving forward. And if we do not address the root causes, then we'll still have the same resistance from the culture and religious perspective. So we really need to transform our thinking, our mindset of the things that we have normalized. We have grown up knowing these things are normal, this is how we live. Let's try to bring approaches that will help us question some of these things and then challenge the harmful and negative norms. This will help us to have the results. And transformation is a process. And I heard when one of the members of parliament was talking about our policies being gender sensitive. We need to move from the sensitive aspect of it, of just recognizing engaging men and boys, and then it ends there. We need to move. Gender transformation is a continuum. It's a line. We have been coming from a background where we're gender blind. We didn't know about these things. We are moving, and now we are sensitive enough to have our men, boys, equal 50-50 representation. We need to move forward and look at other factors that also limit participation. We can have members of parliament, for instance, who are females, but how are they executing their duties? You find that in the same parliament, the same house, the negative, the hidden social norms, they'll say, it's because it's women leadership. I don't believe in women leadership. You see, as much as we've made progress in having the representation, but how effective, how are the women empowered to deliver their tasks? It also comes through to our adolescent girls. Let them be empowered, and we should take a holistic approach. Because when we look at some of these barriers to SRHR or maybe drivers, it's the issue of poverty. We're talking about young people living in rural communities who also feel like maybe marriage, who feel like marriage is a sign of relief to them or a source of income. We need to empower those young people to realize that there is more outside marriage. They can also be capacitated to be visionary leaders as well. So for me, transformation is key. Thank you.
Thank you so much. Deliberately, I asked that they share one more strategy. Please feel free to take away your, if you're one organization or one group that is not aware about how gender transformative approaches work, you have the think tank here for free. I'll move on to you, Diana. You really spoke a lot about the partnerships and the collaborations really earlier. So in what ways have partnerships with other CSOs, government agencies, or private sector actors enhanced your ability to improve access to SRH services for young people? 2 minutes, thank you.
The question itself is taking more than 2 minutes.
Sorry.
But okay. I think for me, I would still say the strength and the weakness in collaboration lies with movement building. It doesn't matter what we want to tackle, guys. As long as we come back, sit down, guys. We failed the last time, what do we need to do? Oh, we need to do this, we need to do this. Okay, you go and do, you go and do, you go and do. By the time you're sitting down with the UNAIDS, for example, or UNDP, you have a very specific ask. It's not just, oh, young people are struggling. This is why we are often told the young people complain. Because most times we come in and talk about all the issues and the problems that young people are facing. Then what? I need to be able to know when I meet UNAIDS, what information I need to give UNAIDS. When I meet media, what information I need to give to media. What it also means is when I eventually meet some of those stakeholders, my usefulness to them is high enough that they start inviting me into those very spaces that we are complaining are usually closed off for young people. So let's make sure we get young people to get involved. And when I mean get involved, I'm not talking about, oh, there's an invitation, let's send a young person. I am talking about, oh, there's a CCM meeting. We are assigning Tsitsi to be the one that goes and does a CCM engagement. Every time we get an email from that engagement, we send Tsitsi. Every time there's anything to do with CCM engagement, we call the same person. They get good at it. They understand the process. And then when we come back as a movement, she's got a feedback from CCM, someone else has feedback from PEPFAR, someone else has feedback from Parliament, and now as a movement, we actually start to see traction. So the strength of our collaboration with all of those stakeholders will always lie with how, as young people, we are building our movement.
Thank you so much. Very clear indeed. Perhaps, Innocent, you can just share one more strategy that you're saying, forget everything, but please take this away.
This will not everything, but for me, one thing that I've come to learn of, and it's picking up slowly, is the need to work at scale. As institutions, we really need to work at scale. And working at scale means putting that institution that will always be there, come what may, when it comes to implementation, to be on the front line. And for us who are in the SRHR field, the institution is the Ministry of Health. If we put the Ministry of Health on the front line, get the best and the right buy-in from the Ministry of Health. One day the reproductive health network might stop working, but the community will not stop demanding for the services. But the Ministry of Health will keep on being there. So if we work well with the ministry, the institutions, the systems that are already in place, if we strengthen the systems that are already in place and work effectively with them, we have a good goal. And then just a bit, the other thing is strategic demand creation. If we go to the community, empower the community about their rights and responsibilities, that will really work out. And I like what Doc said in the morning, that we don't need to keep mopping the house. What we need to focus on is close the tap quickly. So if closing the tap means empowering the woman at the community level to know her autonomy, she won't struggle to go for the condom because she doesn't need to engage in risky sexual behaviors. She won't struggle to share a needle because she knows the risks that come along with drug and substance abuse, and also just sharing such things. So if we create the demand, we strategically create the demand through strategically sharing the information, the right information with the young people and our target communities, that will really work well. Thank you.
Thank you so much. And quickly for you, Miranda, what policy changes are needed at the national or regional level to ensure equitable access to SRHR services for adolescents?
Thank you very much. So for me, I'll just echo the already existing recommendations that we have had even throughout this meeting, which are ensuring that we remove the legal and policy barriers that affect access to sexual reproductive health services for adolescents. And this includes revising the laws, such as the age of consent. One thing I know is we need to agree on something as a region and know what exactly the age will be that we are advocating for. I think when we take that route, we are going to see some change. We also need to ensure that these policies are also harmonized. I'll give an example of Zambia, where we have a Child Code Act that was just enacted. And you will find that this Child Code Act has actually affected our advocacy around age of consent, because then it was at 16, and now it's going to move to 18, because it will be affected by the Child Code Act that defines a young person as somebody who is anyone below the age of 18. So it means everything else changes. That also affects family planning, contraceptives, and the like. I also advocate that we need to increase the budget allocation towards health. And as we are at that, we need to invest in prevention, like we mentioned, we talked about it in the morning. Lastly, I would recommend that we domesticate all the progressive regional and continental treaties that we have signed as nations, so that we ensure that as we domesticate them, we contribute to the achievement of universal health coverage. Such treaties include the SADC model law. We have the Abuja Declaration that we've been talking about. We have the Maputo Declaration and the like. So my call is just to all the members of parliament to ensure that we keep pushing, so that as countries we domesticate these treaties and ensure that we implement them. Maybe just one last thing around financing. I know we have been talking about how most of the countries have very limited funding towards health, but there are a lot of other avenues we can also make use of. Back home in my country, I'm advocating and pushing Ministry of Health to ensure that we also tap into the constituency development funds that have been made available, so that we use those funds to build youth-friendly spaces. We have been seeing that we don't have youth-friendly spaces, but we are seeing Ministry of Education tapping into the CDF funds, and they are building blocks, classroom blocks. They are building toilet blocks. They are sinking boreholes. Why can't we do that as Ministry of Health? Let's apply for those funds and be able to build youth-friendly spaces and things like that. So, thank you.
Thank you so much. Last but not the least, Daniel. Yes, please do share something with us that you're saying, like, okay, forget everything I said, but this one strategy, I'd like everybody to hear about it.
Great. Two strategies. One that I've already mentioned taking on the biostructure social approach in programming and planning. But there's something that resonates deeply with my organization's vision, and that is collaboration. We are called partners for health in villages and communities, and something I'm very interested in collaborations and partnerships. And I'm so interested in discussions the team has had here, and I should say they're very captivating. What Miranda shared, what Innocent has shared, what Dee and you have shared are really captivating. And I would reflect a moment when these brains are speaking in one place, on one platform, regional issues. That is something that we are looking towards. And he mentioned that there was a regional, RMK did something, a conference. Actually, last month, FIC hosted a regional hybrid SRHR conference. We also had recommendations. It was a conference attended virtually and physically by young people across East and South African region. Part of the recommendations were, of course, multi-sectoral approach and integration, inclusion in programming, adoption of ideas of formulation of KSIAs. I'm going to tell you what KSIAs is in a second. Government to conduct vulnerability assessment and analysis, and to develop health adoption plans for all governments in the region. That was a recommendation that came up. Governments also encouraged to respect the commitments under regional and regional frameworks and policies, but also there was a call to domesticate policies and frameworks, and finally, youth involvement in plan, that youth should get to the tables where discussions are made and policies are discussed. But then finally, my call, very important call, this meeting is coming together. KSIAS is Coalition of East and South African Youth Advocates for SRHR. And now this is a coalition that is at idea level. We're working with a consultant firm based here in Zimbabwe to help in developing this idea. In the previous conference that we had, Uganda came up with a secretariat, national secretariat. We would want to have now a working group across the region, a steering committee across the region that is going to work towards this. We have what we call a theory of change. Now, at this point is where people people have up here and the others can put together ideas to even make it more beautiful. But it will be a platform for sharing, for a platform to push for advocacy and to improve SRHR outcomes across the region of ESA. Thank you very much.
Thank you so much. It's been really a very enlightening afternoon. I don't know about you, but I've really enjoyed listening in from the panelists. The director of programs, you're gonna guide us in terms of time. How much time do we have to get the questions from the audience? 10? Okay, so we are going to make the most out of this 10 minutes to just hear the reflections back from the audience, but as well as the questions. So your time starts now, and our able director will lead us into the question session from the audience.
Good afternoon. Thank you, panelists, for the wonderful insights that you have given us. So I really like to agree with Diana when she mentioned the issue of consistency, especially when we are doing advocacy. If there is consistency and you continue to make noise about a certain issue, then the service providers, the policymakers, will definitely take you seriously. I'm from Matabelele North region of Zimbabwe, and I am really learning a lot. And I'm now thinking, do adolescent girls and young women in Kai, for example, know about all these issues? The answer is no. So my appeal is that as youth advocates, let us also decentralize our interventions, our advocacy, and reach to the most hard to reach, so that you also get the numbers to push the agenda. Because if it's just the urban youths who are privileged to internet, who are also maybe privileged to access to information, then the cause won't suffice. But I'm thinking that if the girls in Martin North, in Kai, Bubi, Cholocho, and Binga down there are also empowered the way you are and are also consistently knocking in service providers, demanding their right to access the services, I think we can win. Otherwise, thank you very much for the reflections.
Thank you very much for the presentation, and I really learned a lot. But I think there's one key element that I didn't hear in any of the presentations since morning. I think there is need to also include adolescents with disabilities in whatever programming that we are doing, so that we become an inclusive society. Thank you.
Mine is just a comment to the speakers and to everybody in the room. As we do the different programs for adolescents and young people, can we also have them on the table to tell you ABC will not work? And also, can you be gracious enough when you're doing your project evaluations? Can you just go back to them and ask them, did this work? Did this not work? And be open to taking the feedback to implement and see how best we improve your programming, and also apply an intersection events within the different programs that we have. Thank you.
Thank you very much. My question is directed to the first speaker. It's Diana, isn't it? Okay, so the first speaker, yes. I wanted to ask on the interventions that you are doing, highlighted that you are into gender transformation. I wanted to ask how has been the participation of men in engaging them, especially in the hard to reach areas. And I would also want to ask to all of us that in as much as we are focusing on the adolescent girls and young women, the younger girls, are we doing justice when we are looking to the younger boys in terms of empowering them and also in influencing in terms of gender norms? Thank you.
All right. The way gender transformative approach is, it takes into account 6 principles: the issue of male engagement, the issue of gender and diversity, the issue of values and norms, rights-based approach, women empowerment or girls empowerment. So we take into account all these principles, bringing them together in our programming. So we contextualize the concept. It's a little bit broad and it can be complicated sometimes. So we contextualize it to fit the communities. We train them, and we have what we call the male engagement networks. So these networks are not the networks that are being established, but we utilize the already existing networks to identify men who are champions of male engagement in SRHR. So we go to the youth clubs, youth networks, we identify young boys and men who are champions. So they're also capacitated on the approaches and how they can use their power as well to address some of these harmful norms. So we also engage the males as well as the girls. Yeah, sure. I don't know if that answers your question.
And I wanted you to further clarify, how would you rate the participation of men? I understand here in Zimbabwe, somehow in some interventions, men are difficult to come out and also to engage, especially when you're trying to influence gender norms, either at grassroots level.
Yeah, of course, it's really hard for men to come out because SRHR for a long time has been regarded as a women's issue. So men have been being left behind, or maybe they feel it's not important or somewhat like that. But with the engagement that we have used to be deliberately targeting them and working with them, it is helping other men who do not participate to get encouraged to say, oh, I think this is a good approach now. We are being involved. What was lacking was the involvement. Because we're not involving them, they were also pulling backwards to say, you're only doing things for girls. Continue with the girls, we'll impregnate them, and then, yes, you proceed with your projects. So we are trying to work with them to say, they are also partners in changing all these issues when it comes to SRHR. They're able to understand. Now they feel more engaged, and also they're willing to participate. And we've seen a lot of men standing up. And we have also used what we call the chiefs forums. So in the communities, we have also trickled down the same knowledge to the chiefs, for them to understand how culture and religion affects SRHR. Now they're able also to be champions of SRHR. So like you see, maybe a traditional leader who is male is also part of the male networks that we are working with, which is so encouraging, and they're able to also conduct intergenerational dialogues and whatnot on their own to challenge these norms at grassroots level, which is working. Yeah, thank you.
Okay, thank you so much. My question is to Diana Milos. I wanted to ask, when you mentioned that you have engaged churches here in Zimbabwe, I wanted a bit of clarification on the churches that you have engaged, because we've actually seen that with some programs, like let's say immunization, for example, there's been some strong resistance from apostolic sect churches. So in this regard, I would really want to know which maybe form of churches were actually eager to have such discussions with you, because truly from many engagements that I have seen or attended, there's been so much resistance from apostolic sect churches. Like here in Zimbabwe, we call them apostolic. So I would really want to know which type of churches have you engaged and how it's been. Thank you.
We'll take one more question, one last hand. No, I'm conflicted. There's one. You raised your hand first.
All right. Good afternoon, everyone. So I noticed that we have been more like generalizing the age group for adolescents, but we have early adolescents and later adolescents. So I noticed that I'm a deputy parent with a child at home. So she is informed too at, I think that's about 16 years. So at 16, I already hear stories about relationships and stuff. And I wonder what they are doing at 16, but I've heard them talking about nudes. And I wondered what else they could be doing that they don't talk about with me. And we speak about SRHR, yes, we say adolescents, but we cannot give contraceptives to a 16-year-old. So what are we doing if they are talking about nudes? Probably they're doing something better than that. So my question is, how can we effectively engage with these younger adolescents? How can we effectively give our SRHR services to 16-year-olds? And are we doing that? Or we are missing the point? We're just saying adolescents and we go and help 18-year-olds and then we leave the younger age thinking that they are children. But in this generation, they are already doing things that we do not know it's their age just because of digitalization. Thank you.
All right. Please allow me to also start talking maybe to the deputy parent. I think this is the reason why we are talking about opening access. And I think every time we talk about opening access, people usually think of what we call the buffet approach to giving contraceptives. Come on, come get it all. I have Brufen and I have Depo and I have no plans. Take it all, take it all. No, we still are using medical providers who have been trained on appropriate medications, appropriate services, appropriate things to give to every client that walks in. So I can assure you, if your 16-year-old sister wants to go and sit down with a medical provider, they will get an appropriate service. They will get the right contraceptive. It might not be no plant that maybe she wants when she walks in, but she will definitely be assisted in a way that she remains safe. So I think we still also need to put a level of trust in our systems, because a lot of us, we are proud of our healthcare workers, but somehow when we start talking about anyone under the age of 18, it's almost like, yeah, but I'm not so sure if they're good at their job. So I think we also need to be able to acknowledge that and realize that a lot of these conversations are more moral conversations than they are medical conversations as part of that. But to also answer, I think, three reflections I heard. There's one who was talking about the hard to reach young people. By virtue of being civil society organizations, there's only so much we can do. Yes, we've engaged young people in Kai, we've engaged young people in Lupane, and our contact young person was actually based in Wange, who was mobilizing young people from that region. But of course, the challenge that then often happens is we have limited funding, so there's only so many we can engage, even if we engage 2,000, but how many are in a province, right? So there's only so much we can do, and that's why I think by design, I often say this, and I know my friends, always judge me for saying this. By design, as an advocate, I should be working myself out of a job every year. So the more we get a lot of these laws and policies addressed and they become systemic, the less we start to also see some of those gaps and challenges that are there. Because right now, we could have a program on TV that's talking about safe sex. The reason we don't have it, back to access policies and laws, right? So those are some of the issues that there's one who also talked about inclusion of youth with disability. The last meeting we had, which had the Parliamentary Portfolio Committee on Health and the Minister of Health together with his team, we actually did have a young person with disability, and I think she's actually here today. So we have been engaging. We've been engaging young LGBTIQ+, we've been engaging young sex workers, young people who use and inject drugs, young people from rural areas, and we've tried to at least to be very intentional about our engagement. But it also means, remember, because we are civil society, our resources are also quite limited. So there's only so much we can also do in terms of being able to engage. And last but not least, there was a question around engaging churches. So usually when you want to engage churches, I would recommend that you start with what we call the church associations. So your Judas Caesars, I think that one would be the more relevant in the conversation that you were talking about with regards to the white garment churches. You're looking at your EFZ, you're looking at your those entities, because once you are able to have a conversation with them at that level, then they also start opening up an avenue to then engage with all the other church leaders as well, because they also have their own structures and their own ways of working. But I think for me, I would encourage that as a really good starting point.
So thank you so much. I can actually see that somebody is really bending up to respond. So yeah, we are really at the peak of time. So please, if you're going to respond, make it very, very snappy. Yes.
Just a quick one for the deputy parent, first of all. When it comes to offering sexuality education to our adolescents, actually it does not begin there when they're adolescents. If you look at the module of sexuality education, it's age appropriate. And basic things, I will give an example. When your kid is around 2 years, the boy, when he's around 2-3 years, when he wakes up, he'll have his penis erect. And he'll come and tell you, Mommy, it has. Do you beat that kid? That is where we begin the information. So it's by creating that safe space and sharing with this kid. When they get to 4 years, the Oedipus and Electra complex, the girl wants to say that she sees you as the competition, and how do you maneuver around that? So for me, I see sexuality education maneuvering going on from when the kid is very young to adulthood. So it's both your role to understand how do you create that safe space for the girl or the boy to share and openly talk to you. I think we were having this a small session with Dr. Godfrey, and he shared with us that it's actually exactly the same situation. Us just being in a position to create that safe space for our adolescents to share with us whatever they are going through. And then how to reach to
Thank you so
men,
much.
just 30 seconds, how to reach to the men what we've been able to do for us is getting men at where they are best at. So if in a community we realize that men have taken up leadership positions in the church, men are there taking up leadership positions. You go to the community, the chiefs, the sub-chiefs, the police officers. Now, how do you take this police officer and help them to understand how his role can promote SRHR? How do you use a teacher or a pastor and help him to understand how his role can promote SRHR? So if we are able to do that, because that's what we'll be doing at RHLK, if we're able to put that into context, that will really work well for the men in the community. Thank you.
Thank you so much. Lastly.
Thank you. I would also like to respond to the question around persons with disability. I would like to just inform you that for me, in our organization, we are working with persons with disability in many ways. We are deliberately employing sign language interpreters and training them to be community facilitators so that they can be able to provide services to persons with disability. We are also working with our friends with albinism, and that has also enlightened my knowledge in knowing that there are actually certain contraceptive options that don't work for them, like that of Jadel. I've come to understand that. We've also given them platforms to also present their challenges to Ministry of Health, and one of the challenges was that they are not involved in health messaging. And since the time they made that recommendation in 2021, Ministry of Health took heed of that recommendation, and they are now ensuring that every health messaging that is done on TV has a sign language interpreter attached to it, and they get to understand those messages. Thank you very much.
Thank you. Silence means I've been given go ahead. So I wanted to just respond to a question of male involvement. And members have spoken to what they are doing at CSO level, but I want to bring what I think is the best practice at a national level. Uganda in 2014 adopted a national strategy on male involvement. And this was a HWO recognized document that spells out how to involve men in family planning, in HIV testing, in nutrition, in all areas. Because there were in the 1994 Cairo Convention on Population and Development, it was noticed that male involvement is really, really poor. And that is why the initiatives, and this was a call from HWO to all nations to develop a male involvement strategy so that all CSO, all public and private health facilities can follow that. Yeah. So it's a PDF document that is available. Yeah. Thank you very much.
Thank you so much. I know it's getting towards the end of the day, but thank you really. You've been such a wonderful audience. I felt very supported and very inspired. And I think the panelists can say the same. So from all of us here, we're saying good afternoon and thank you so much. It's a part where you clap and encourage us to sit.
Thank you so much, Chanda, and your team for that insightful panel discussion. We are quickly going into our last session of the day. This session will be facilitated by Doc. Doc, please make your way to the front. But even as Doc makes his way to the front, are there young people who attended the Regional Adolescent Health Endowment here? If you did, raise your hand. Were you there? I have a task for you. So quickly mobilize yourselves because you are going to be giving us an energizer after the session. There's something special that we did at the Rahai that we want to bring even to this meeting. So mobilize yourselves, go to the DJ, do what you're supposed to do, and then you come and do that as we conclude. Doc, we have your attention.
Okay, thank you so much. So this is session number 7, overcoming cultural and social barriers to SRHR access, the role of community leaders in ensuring enhanced uptake of SRHR services by young people. So I want to call these panelists up here in front. We have Reverend Oju. There you go. And then we have Pardon me if I don't pronounce it very exactly, but Mr. Nechiva. And then we have a parent caregiver, Mai Chuai. And then we have a young person on the Dreams Youth Advisory Board, or rather is a chairperson actually, Bongani Sivanda.
Yes. Wow.
And then we have Mrs. Mutseta from the Ministry of Health. Okay, so we want to make a disclaimer here that this panel is all Zimbabwean. All right, so the cultural and social barriers will be those experienced in Zimbabwe. And it's not that we don't want to hear from the others. It's just that for now, this panel is Zimbabwe. But we also know that in the group there are parents and I don't know, are there any traditional leaders? But I'm sure we'll support them. So anyway, let me start with asking each one just to introduce yourselves, beginning from Reverend Julie here.
Right, I'm being heard now. Good afternoon, ladies and gentlemen. Allow me to bother you by introducing myself as Paul C. Juru. I've got a background of, education, having been a teacher, then rose through the ranks to be a headmaster or a principal and the director of schools. It's a very high institution there. And, but somehow, I ventured into the NGO world. And because of that, venturing into the NGO world, I got exposed to issues of SRHR, and I became an ardent disciple of SRHR. Why? Because of my experience with working with the kids within the schools. So whenever I get into spaces like this, I feel that I'm in the rightful place. I then found myself working with INERELA, which is an abbreviation meaning International Network of Religious Leaders Living with or Affected by HIV/AIDS. It was a brainchild of the Ugandan pastor, Gideon Bayangisha, who was, excommunicated from his church, the Anglican church by then, because he got HIV positive, resulting in him being excommunicated. So issues of stigma and discrimination started within him, and he saw the gap. And he formed this organization, which has now employed us. So whenever we are talking of SRHR issues, we are talking of issues of our boys and girls being stigmatized. And that is why we take these issues seriously. So thank you very much.
Okay. Thank you.
Manero akanaka vanhu vose vari muno. Inonzi Sabhuku Nechiva. Zvatinoda isusu pachivanhu chedu, toda kuti vanhu varapwe vechidiki, asi titeedza tsika dzakanaka dziripo. Hatidi kuti vana vadzokere pakudya paguchu pakumwa mishonga yakaipa iyeye ndakuti yakaipa mishonga iyi yakaita kare isusu kunikeka maguchu. Naizvozvo vana vanoda kudzidziswa, vana vanoda kudzidziswa kuti vave nehygiene nema practices akanaka maita here.
Thank you. I didn't pick that, but I hope people picked it. Yeah.
I am Maichiwai from Zimbabwe.
Good afternoon. He said his name is Sabukune Chiva, and basically he wants young people to be taught about hygiene and how to take care of themselves, but maintaining the concept of Ubuntu, maintaining the African traditions that we have. He's a headman.
Okay. I'm Maichiwai or Chiponjeng from Zimbabwe. Ini ndakatanga ndiri caregiver from second rural home based care. Chakava chinhu chakandibatsira zvizhinji munharaunda yemuno muZimbabwe. Chakabatsira vana vakawanda kuburikidza nekupuhwa ruzivo. Ndakazova CCW under social welfare. Zvinoreva kuti child care worker. Social welfare ndio varidzi vevana. Ndio hurumende yacho. Saka ndio kwandiri based ikoko. Aiwa ndinotaura kuti hakuna nyaya inoraruse kwemupredio semutsvairo. Nyaya ngaiende painofanirwa kuendesa tobatsira vana.
Thank you. Do you want to translate that as well? Otherwise.
Her name is Chipo Chiwai. She's a village health worker as well as a child care worker. So she works with both the Ministry of Social Development as well as the Ministry of Health and Child Care. She said that there is no issue, if there's an issue that has been risen and has been shared with them, there is no issue that will go unattended. She attends to all issues. She cares about issues to do with adolescents and young people.
Thank you so much.
Good afternoon, everyone. My name is Bongani Swanda. I started off as an AGYW for the Dreams program, and I was introduced to the Youth Advisory Board, where I'm currently the chairperson, and I'm an SIA champion, and I'm centralized in Cholocho, which is a rural setting based in Matabeleland province, where religious and social barriers are deeply cultivated, and I'm hoping to make an impact to change that. Thank you.
Thank you. Yes. My Uteda.
Just to make it short, so I'm Miriam Teta. I'm with the Ministry of Health and Child Care. I'm the Key Populations and Dreams National Officer. My background is in social sciences, and my passion throughout my career has been with the HIV programming from around 2000, and mostly focused on new innovations. I've been in the HIV post-test services provision space is the coordinator, introduction of ART adherence for the country, HIV testing services, and I was also the lead of one of the biggest initiatives for the introduction of HIV self-testing in Zimbabwe. Currently, I'm in the DREAMS program in key populations, like I've said, and of main focus for the Ministry of Health is the introduction of biomedical interventions HIV PrEP being the most potent in the topical biomedical intervention, where as a country we are proudly saying we have oral PrEP, injectable PrEP, the ring, vaginal ring, and we are working towards increasing options. Why these biomedical interventions are important to young people is they're generally affecting mostly the adolescent girls and young women. You've got high incidence among the population, therefore we really have to turn the tide in in new infections. And I'm happy that during the course of this discussion, it also came out that HIV, to some point, to some extent, ended up not being considered as an SRH issue. But now that we have reached the epidemic control, Zimbabwe has proudly reached epidemic control. It has now also come a point where we now have to rationalize a number of policies and also realign a number of issues with the SRH.
Thank you so much for that introduction. Now, I want to say, or rather read out a statement which I got from, I think it's the UNFPA website yesterday. And it says this: according to demographic health data for Zimbabwe, nearly 40% of girls and 24% of boys are sexually active before they reach the age of 18. About 24% of girls aged 15 to 19 are either pregnant or mothers. 21% of all antenatal clinic bookings made between 2019 and 2022 were for young girls aged between 10 and 19. Out of the 1,532 maternal deaths recorded from 2019 to 2022, 25% were adolescent girls and young women. Have you heard me? It seems clearly that we have a problem. Now, the young people here are saying one of the challenges is that they are not adequately supported with education, information, and services to empower them to avoid unprotected sex, including access to contraception. And one of the barriers is that one has to access, if the adolescent has to access services, they have to be accompanied by a parent to give consent. Now, I want to start with Madam Motseta there. How are you working with communities to ensure that young people are accessing the services they need?
Let me start by acknowledging that there has generally been an outcry among our communities, especially from the space in the background that I've given you, that we have generally been over-empowering the girl child at the expense or at the expense of the boy child. However, this has come from the statistics that you've just given us. How do we mitigate those challenges? And I also liked, at some point, we also talked about the mismatch, and even our deputy minister, in his opening remarks, he said, as ministry, there are policies that we have already adopted that reach out and try to save and do no harm to everyone. And this also applies to the adolescent girls and the young people at large. But you also find that the systems at times may fail or may appear to be failing because of the mismatch with the laws. What the law says, the provider will then say, of course, the ministry will say there's mature minor, there's the best interest of the child and so forth. But how am I protected as a provider? So at times it then takes a lot to convince the provider to provide that service, that service to the young person, because they fear that if the parent then puts their foot down, some parents are very empowered, which laws are going to be protecting them. So we, in as much as we've got our patient charter, in as much as we've got these policies, it also goes back to how much are we pushing for some of the changes. I'm sure for Zimbabwe, you know, our age of consent was 16 years, just recently, just yesterday. But then we harmonized because we realized that there was a mismatch with the age of majority and the age of consent, the age of marriage. And that harmonization brought everything up. And overnight, we're also having a nightmare as ministry. Well, what are we going to do about HIV testing services? What are we going to do about SRH services? So the space has had its challenges, and as a ministry, we always try to align and improve our policies, but we also need the hand coming from Parliament on how best we can navigate the space.
Okay, so there you did, I heard you that there is also the role of parents, isn't it? And I would like to also believe that traditional leaders and religious leaders are also the gatekeepers, you know. But now I have raised this issue. What do you think as a parent is your role to help us reduce these numbers of adolescent pregnancies, especially taking into account that it is young people below the age of 18, and yet the ministry is saying, oh, when we face a child of 15 coming to get the sepsis, they are worried of parents. What should parents do? What is your role to help us that we address, we reduce the rate of pregnancies in Zimbabwe?
Role yangu semubereki ndinofana kutanga ndapuwa ruzivo nokuti ruzivo runokosha.
As a parent, I first need to have knowledge because knowledge is important.
Ukapuwa ruzivo wakuchitanga mumba mako usati wabuda kunze. Takutanga nevana vangu nevazukuru vangu kuvapawo ruzivo rwandawana.
I would then start educating in my household, starting with my children and my grandchildren, the knowledge that I will have.
Ende zvakare tine ma-NGOs vakatipa ma-toll-free number ekuti anogona kutibatsira. Andinozofambawo nawo ndapuwa ruzivo rwuya ndinofamba nazvo ndichivaudza.
We also have NGOs that have toll-free numbers that can also educate us over the phones. So when I move in the community, I then go with those numbers to inform others.
Yes, 393, toll-free number. Second, 08080552. Ndinofamba nayo, vana vangu vachafamba nayo, vazukuru vangu vachafamba nayo. Panowana dambudziko akufona mahara.
The numbers that she mentioned, when I move around, I will move around with these numbers, and even the young people within the community will know these numbers and move around and share with their peers these numbers. And if they find themselves in need of information, they can call on the toll-free numbers.
Ende zvakare kana uchinge wapuwa ruzivo, nyatsotaura nemazvo, kwete kuzotaura nepausingazivi, nekuti vana vanoda kutaurirwa zvechokwadi, zvisina kupokana, because vane mibvunzo vana veda. Ndofunga tese tiri vabereki muno, vana vane mibvunzo kuti munhu unotadza kupindura.
When you've been educated, then it is your duty to educate properly, because these young people have questions and they need us to give them information, correct and accurate information.
Makambona mangombishi ichidyiwa nesalt inowawa ende inoitisa ugugu. Tikuti mango rega ibve munyatsotyikawo zvakanaka. Ndinofamba naro shoko iro.
She spoke in deep Shona, guys. I'm trying to. I had my mouth like, because she spoke deep Shona. But basically she's saying that
you can't eat a raw mango with salt because it is sour. So we need to be careful with the information that we share so that we don't give the wrong information, we give accurate information. A raw mango is sour.
Rega nditaure ndichiti munharaunda imomo semubereki ndinotaura zvakare kuti regai dzive shiri mazai haana muto.
She is really trying. She is really trying. Okay. I'm just going to say the interpretation, not the direct translation of the idiom she's used. And she's saying that let the children grow to become who they are meant to be. Don't take away their potential.
He says, don't eat the egg.
That's the direct translation. I expressed the meaning of the idiom. The direct translation would be, go for the birds and not the eggs. Because the eggs don't have soup.
All right. Okay, now, I'm forgetting the names now. The young Bongani, listen carefully for now, because the question I'm going to ask you is not, you're not going to, no, I'm still coming. But the question I'm going to ask you after is, what kind of support do you need from the gatekeepers? So as they're expressing themselves, you should have that in mind. Okay. Now I want our traditional leader here. We call them in Marseille Gogo Chao. The traditional leader. Now you heard me what I said. We are having problems. Young people are getting pregnant, but if they get the services they need, maybe we shall reduce the pregnancy. What is your role? How can you help us to reduce these numbers of pregnancies?
Vatinoita ini sema-traditional leaders tinounganidza vanhu tovataurira kuti age of consent i 18 years. Anenge awanika chakaipa nemwana below 18 anosungwa. Atimbozwanza izvozvo. Tadaro tinoisa nyaya kuma-relevant authorities. Ngachiti mwana arepwa. Tinoenda kuma mwana arepwa. Tinoenda kuma relevant health provider. Which is kuchipatara aenda paanokanzerewa wotorwa pakudeni kunotorwa nina doctor polisi ichita basa rayo. Tatenda ndezvokuti iye mwana iyeye anofanira kupuwa service yaunoti post prep tomupisa marevent authorities ivo ndovanozoita pamberi ndachimasabhukwati zvive zvakawanda pamberi tofanira kuziva kuti ndinofanira kugaidha mwana kwaanowana service iri yakakodzera naye.
Okay, he said that his duty as a traditional leader is to mobilize people within his community and inform them about the laws of Zimbabwe, which state that the age of consent is at 18 years old. If anyone is found having sexual relations with someone who's younger than 18, they make sure that they go through the legal processes so that they protect the children. And if a child is raped, they also refer to relevant health facilities to ensure that they receive the services that they need. for most of the services that need access to sexual, reproductive, and health services, they refer to the clinics. And what needs the police, they refer to the police and ensure that everyone within the community knows.
All right. So, how about religious leaders? The same question I'm asking. What is your role to ensure that young people are getting the services they need in order to avoid unwanted pregnancies?
Thank you very much. You'll find that religious leaders play a pivotal role in promoting the uptake of SRHR services. One, you start by looking at the power of influence of a religious leader, the power of the pulpit in changing mindsets. The churches that we come from in Zimbabwe, they are quite diverse. We have what we refer to as the mainline churches, which are actually organized, as she said earlier on, under ZCC, that is the Zimbabwe Catholic, is it what she is here, the representative of ZCC. And then we also have the, we also have the Union of the Development of, Apostolic Faith Churches, which we refer to as UDACISA. Those are the white garment churches. Then we also have the Pentecostals. Take it, Papa. See, those are organized under EFZ. So we have various, denominational differences or doctrinal approaches here and there, and belief systems. But the idea is we all worship one God. Then the role of a religious leader from either of those organizations, one is to reinterpret religious texts, those that promote the uptake of SRHR services, which also help in terms of promoting compassion and love. We talk of Mark chapter 12, verse 31, love thy neighbor. So if that message is sent throughout, the kids or the youngsters are going to be loved by anyone who is, having authority over them. And by that, they are going to be exposed to SRHR services. They are not going to be in a position to be raped. Mind you, I was chatting with you this morning that last night I had some UN news declaration saying 79 million children or girls in sub-Saharan Africa are exposed to sexual abuse before they reach the age of 18. Ladies and gentlemen, it means that we have a duty to play as both religious leaders and people in general. So, interpreting religious texts to support SRHR services, that is the one duty, and to promote human dignity and well-being of people within our churches. Then we also advocate for social justice and equality, then also protection from harm. We have a very sorry case which happened in 2022 in Zimbabwe of one Memory Machaya, who was 14 years. She went to a shrine and she was, impregnated there by a 17-year-old boy. And because she was belonging to the white garment churches, they wanted to really conceal that incident. And then eventually the girl died. Then it arose a lot of havoc within our nation. Why? Because it was being done in the interest of a church. So that's where we now need to be in a position to talk to the leaders of those churches to say, look here, this is violation, this is sexual violence. And by that, we are permeating gradually into the churches. They are now addressing such issues within their various platforms. Then obviously, as a church, we need also to provide accurate information and education on SRHR. then encourage open dialogue and discussions on these issues within our churches, then challenging harmful and cultural and religious norms, which do form barriers to the implementation of SRHR services. You know, such religious barriers like one where they talk of contraception, restrictions, family planning restrictions, abortion, stigma around abortion and prohibition, then also barriers like, you know, sex education limitations. At times within the churches, some of them become too holy that they don't want to talk about sex education. Then looking also at women's reproductive, you know, autonomy, it is at times restricted or limited. So that is what the church aims at doing in Zimbabwe and possibly the world over. Thank you.
I'm listening to that, and I'm Catholic. Malawi, of course, you are Zimbabwean. But what you just say, the ideal sounds very nice. That is why I'm going to ask now, what is the experience of young people? So, Bongani, you are representing young people. Yeah. What is the experience of young people? Because the gatekeepers have said that they said they will encourage access to information. They say that they will address sexual abuse, and the churches will interpret doctrines out of love and all that. But what is the experience of young people? And what would you ask of the gatekeepers as support?
Okay, thank you. I would say, firstly, I'm a young person, and I'm someone who is actually part of those religious sects where access of SRA services are not really an option. So, as an advocate, I would make these leaders my allies in promoting the health of young people and engaging with them in certain meetings and building bridges so that we can break these kind of barriers, both religious and social barriers, and also presenting evidence-based services like dressing the SRH services in a way that young people would understand and would actually want to access and would want to feel motivated to access. So yeah, I think that would encourage an inclusive and accessible thing for young people in the southern region.
All right. I can't quite grasp it, but we have a problem, 29% pregnancies. What do you feel that the gatekeepers are actually supporting you or not? Let me just be direct about that.
Okay. I'll speak from my district where I come from.
Yeah.
The support is there in disseminating information, but when it comes to actual service provision, it's lacking. It lags because there's a lot of discrimination when it comes to age, gender, and religion. So yeah.
So yeah, there's a lot of discrimination. And I see the Minister of Health is smiling there. What do you want to say more about that? Because I mean, like, okay, well, the gatekeepers have said what they did. And if it was the ideal situation, I think the rate of teenage pregnancy would be 5%, but it's 29. All right, so let's go back to the Minister of Health. You engage, you already started to say something about, well, the age of conflict is that. What do we need to do? What do we need to ask from the gatekeepers, okay, in order that we must make services available even for persons below 18? Or are we saying the law is the law and that's it?
Why I was smiling is this always comes up when we are engaging with young people. It's always centers on the attitudes of our providers, and I think in the morning our ministry was also mentioned how we are also making those efforts to roll out the services to improvement of the services to adolescents and young people. I think we had covered so many provinces, and we are now districts and facilities, and we are in the process of continuously reminding our providers of the WHO age standards. In Zimbabwe, we've got nine of those standards. So having said that, I also have questions that maybe throwing spanners into this whole thing. We have families represented by the gatekeepers here. There is always a conflict of maybe what we may term modern society versus our culture, and what gives family dignity. We go, I know, for example, we've been to districts that border with South Africa, where if you go into the ANC and PNC, the number of young girls that we see here reflect those statistics that you're talking about. But to them, the question is it an issue? At times we assume it's an issue when probably it's not an issue, depending on what gives the family dignity. What gives me dignity as a girl is probably getting married and starting my own family. Getting a husband is priority. And this whole business of going to school, having your first degree, these days when someone has a first degree, they then go on to do a master's and possibly a PhD, and you are not married. How is society going to be viewing your family and you being single, economically empowered, of course? So it's that balancing act where the statistics may be showing that it's a problem, but to the community, maybe they are not even defining it as a problem. This is what the natural progression, this is what they expect. A girl child should be married early. And you also look at even our men. I don't know whether it's a Zimbabwean thing, but men also seem to be very consistent about the age of girls that they look at. They are always in the teen 18s. I always say this. They're very consistent. At 18, thereabout, they're looking to marry someone maybe 16, slightly younger than them. Around 25, they are married, but they still go back to the young girls. At 65, someone around the men, unfortunately, sorry to use you as an example, when your wife dies in Zimbabwe, it's not surprising that they will then go and get married to an 18-year-old. So those are the pressures that surround the girl, and also not forgetting the economic situation that we are in. So we are, and as a parent, I'm also looking at, it's more important for me to have a grandchild. I'm one good example. I know my daughter went to school forever, and ever is a chartered accountant, but by the age of 32, I was looking at him, they were saying, is this one going to give me a grandchild? She knows it's the first child. So to me, it then dawned on me to say, this is what most people think about, that this is what, I was now looking at, is she giving the family a good impression? People are starting to talk about what is she doing anyway, and things like that. So in as much as health services strive to reach, and we try to make our facilities friendly and give access to the services, there is also that limitation based on our cultural background and our cultural beliefs, of which I don't know where the meeting point would be for us to meet each other halfway, or maybe we might need to redefine something along the way.
Okay, I thank you for that. I do appreciate that child marriage is one of the issues, but let me put it to the gatekeepers. If a child of 15 is engaging in sexual intercourse and she needs to access contraceptives, What do you think about that? Will you facilitate? Let us start from Ogocharo.
Yeah. Mwana atanga kuita zvebonde aine 15 years. Rega nditi bonde haritwe munhu achiridzirwa hosha. Rinoitwa munhu akawanda. Inini handimbofa ndakaziva kuti mwana wangu akutanga kuita zvebonde. Kana tese tiri muno tinotsigirana kuti hapana anombozviziva kuti atanga kuita zvebonde.
She was saying that no parent really knows when their child indulges in sexual intercourse, because no one will be there to applaud you or play instruments for you whilst you're having sexual intercourse. You do it in hiding.
Saka zviripo ndezvekudai sevabereki. Tiri kungokurudzirana kuti mwana zvinotori nani kana ari kutora family planning yake, kana ari kushandisa makondomu, nekuti kondomu rinodzivirira HIV, rinodzivirira nhumbu. Saka tinotoona kuti zvinotori nani, ende hazvitori ndichiona kuti ende handisi ndinomukurudzira. Otherwise azvinzwa kuye patambenge tichiti vanhu vapiwa ruzivo. Inini ndisingatozivawo kuti akatozvinzwa. Ende anogugula mumafoni. Inini handitogoziva kwaanoenda kumafoni ikoko.
So as parents, it's better for your child to use contraceptives or condoms, because condoms also protect from other STIs. And sometimes we don't even know that our child is using contraceptives, because they would have maybe accessed them where we were talking about that they collect information from, or they might be even Googling on their phone. And as a parent, I don't really have access to know what information my child researches about on their phone.
Saka ini semubereki ndinotoona zvinotori nani kuti handina kuigirwa vazukuru vetaipi yakasiyana siyana, mbuka dzaakutongana mumba. Handina kuigirwa, ende HIV handisi kuigirwa nenhau kuti ari kushandisa zvaari kushandisa. Ndotoona kuti zviri nani.
As a parent, I think it's better if my child uses contraceptives as well as condoms, because direct translation, this is stemming from the totems. I will not have many animals in my family. This is based on the totems, not on the children. I will not have many animals in my family. My child will not have HIV, and I am better. They are healthier, and I do not have burdens because of teenage pregnancy.
Zvakare, regerai ndiedhe ndichiti, zvinhu izvi zvinopuhwa pachena kuclinic, kuhospital, kupi. Anongoenda achinotora makondomu. Maservices akaringonoita free. PrEP it's for free, PEP it's for free, makondom for free, maservices ese kurapwa ikoko vanopuhwa ma-referral letters. Pane ma-referral letters ari kunyorwa nema-caregivers nema-health workers otongoenda unorapwa indisikazive for free.
My child can get these services for free at the local health facility. They can get referral letters from the caregivers and village health workers. They can have PrEP for free, PEP for free, condoms for free, and other medical services that they need. They can get referral letters.
Thank you.
All right, okay. That's, I would call you a progressive parent. Now I will turn to Mr. Neshiva. You have heard a very progressive parent saying a 15-year-old can have access to contraception and all that. I would like you to tell us about the parents in your community. Do parents have the same progressive thinking as a parent beside you? What collectively, would you say the parents in your community would think about access of a 15-year-old, would they support?
Vabereki vane vana vari below 18 years vazhinji vacho neurombo huriko mazuva ano vanototambira zvinonyanya nevana, vanotokurudzira vana kuita chipambi. Vazhinji vacho havazitarisire kuti vana vanotarisira kuti vana vane maservices asi vanoda zvinhu zvakawanda kubva kuvana vacho. Saka ipo pari trick. Vanoda zvakawanda, vanoda mari nekuwanikwa kubva kuvana asi ivo voti vana ita maservices. Maservices vacho vasingazive kuti ndati kuti mari ndozogumira zvangu ipambi chowandisa.
Okay, because of the economic situation, some parents in his community accept gifts, accept money from children even below the age of 18, which then promotes sex work, and then they will also encourage their children to get services, but they don't know what these services are that the children are getting, and what challenges they may pose to the children. The situation is tricky because parents will want the money and the children will be young.
I kind of, let me rephrase again. A 15-year-old girl becomes sexually active. There's no one bringing parents that they gives to the parents, right? So that 15-year-old seeks contraception, condoms to use to engage in sexual intercourse. Will the parent facilitate that, or would the parent try to block it? Maybe it's a leading question.
Mafungira angu ini vabereki havafanirwe kutokutaura kwamboita kandandika zvakanaka.
Ndikutranslatere. Vari kuti vabereki munharaunda yenyu yamugere inini vanobvumira here kuti vana vavo vane ma15-year-olds kuti vawane inonzi chii macontraceptive nyangwe vatanga zvepabonde? Vabereki vanondozvibvuma here? Ndozvamubvunzo waura unyatsoti mudaire uyu.
Vabereki havabvume zviri open. Vabereki havabvume zviri open. Vanongotaurira mumwe munhu Sawira kuti Sawira taura mwana wangu uyu kuti adzidzise zvakati, vandipa mwana wangu enda naye kuclinic. Kana tiri smart traditional leaders zvatoita tinopa mareferral slip toziva mwana kuna health work ari muvillage health work. Village health work ndiyo paoenda nemwana iziva kuti mwana uyu paanowana service inoenderana nezvaari kuita.
All right. He is saying that openly the parents will not support this. They will either talk to the family friend, the Sawira, to say, talk to this child, or even talk to the village health worker, then to talk to the child and ensure that they receive the services that they need, but openly they will not, because they are afraid of being stigmatized.
So openly not, maybe secretly, yes.
Yes.
Well, let's come to the religious leader. You did talk about something, interpreting the gospel in according to love your neighbor. How could that assist you to facilitate access to contraceptives for a 15-year-old boy?
Well, as a church or as religious leaders, we want possibly to avoid a situation where our youngsters will end up, indulging in sexual issues and getting access possibly to contraception before they turn to the age of 18. So what we actually do is to engage in youth-friendly religious spaces and teach them on the values of abstinence before they attain the age of 15, the age of 18, where they are permitted to engage in such issues. And in this particular case, we integrate SRA, HRE into religious education so that they avoid possibly getting into teenage pregnancy issues. But however, if it happens that a 15-year-old church boy or church girl becomes pregnant, we are progressive religious leaders. What do? There is an element of stigma and discrimination there, right? You need also to save that person. You are not one going to be in a position to demonize that. It has happened. You don't demonize because you may break that child. So what you have to do is, that's when we partner with the Ministry of Health, the nurses, they take over from us. And if at all that's the law that has been broken here and there, the police will do their work.
You say a number of things. You have put in pregnancy already.
Mm-hmm.
So someone is already pregnant.
Yes.
And then it is a police case.
It becomes
but how if a young person, that they're going to engage in sex anyway, would you facilitate the access, or would you say, no, that's not my role?
Right. It becomes a tricky issue. We don't encourage sexual activities before the age of 18. We need to respect the laws of the country.
Okay.
So when it happens that way, it is something else that happens. That's why we then interact and refer to some of our partners who are in that area. Ministry of Health, what do we do? Police, what do we do? This is the case, and the law will take its course.
All right. This is a political conversation.
Right.
Now, as a young person, Bongani, what's your feel here? Maybe the last word before. What's your feel here? Would the religious leaders, the gatekeepers, support persons seeking contraceptives or not?
In terms of religious leaders, I think we both play a pivotal role in ensuring that the health of young people is prioritized. And I think they would ally with me in this case to promote such health.
Access to contraceptives.
Is access to contraceptives. And also in the religious aspect, I think they would also help me to advocate for people of religious involvement to also get this access to health services.
Okay. All right. I'll now just give it over to the audience a little bit here. As you have heard our conversation, it's kind of tricky, isn't it, that when I raise a specific issue, it tends to run away to something else. So for me, it's a bit of a challenge. Now, what kind of questions would you have for our gatekeepers?
All right. I think I would address my question to the two gatekeepers to then say, most of what you are saying seems to be responding to the law. If the law were to change, would you support your children to access services? Or would you then fight the law to be changed back?
Ndinofunga kuti law yakachinja, age of consent ikachinja, zviri nani kuti vana vapuwe maservice.
He's saying that if the law is changed, he thinks that it's better for the children to access services.
Okay. Young people, your opportunity here, the gatekeepers are right here. Oh, he wants also to respond.
Yeah. The laws should be progressive, promote the human dignity and healthy of the human beings. I don't think there is any law that can actually go to such low levels to say at 15 years be pregnant. So what we are saying as gatekeepers, possibly as religious leaders, there is a reasonable age of majority where some of these things are permitted to happen. Now, if at all is going to be a change of law, then we engage the policymakers and we really talk through the intended, amendments. Are we doing the correct thing or are we doing the wrong thing? Then we convince each other and we go on. Because the church plays a pivotal role in engaging or in advocating for positive policies. That's my take.
Okay. Okay. I'm glad that you are having confusion over us as young people. My first issue, I think the first one is going to the parents. I think our parents, if you act like our parents and not like our ancestors, it will be well. Also, to the religious leaders, I think if you don't take everything theologically, we will go far. Because sometimes we tend to turn everything into religious things. Like you end up on lose some verses, like mentioning Bible verses to me, John chapter say this and this and this. And sometimes we tend to fear speaking about sexual reproductive health. Also, the other issue I think that is contributing to those early teenage pregnancies and new infections is because sometimes, let's say you are the religious leader and your relative is a perpetrator, it becomes a problem. Those stages that you are mentioning, you won't take those stages because the perpetrator is your relative. And what is working currently is who is your relative, and you'll be using that as an advantage to you. Then to my champion, and the last one, I think it's high time for us. That's why I started by saying I'm glad that you are having confusion over us. It's high time for us to stop the blame game. And if you see that these guys are confusing you, come to us. We are there. Call on to us. We shall respond. We are there to respond each and every time. Thank you.
Okay. There's another.
Just two more questions, Doc, because of time. Yeah. So one more here.
Thank you. So my question goes to Reverend Paul, and I say this with I don't know what word to use, but I'm very certain that the church plays a very big role in our social conditioning. It's almost like if I go to church today and what I'm told is the gospel truth, and I'm prone to practice what I'm taught. It's as good as going to school, as good as going to other social institutions that play a role in the social conditioning of human beings in our communities. So my question is, insofar as you are working with religious leaders, are there any strategies that you have put in place to make sure that the religious leaders are well informed? Because sometimes young people or even other key players or key stakeholders in society go to church and they get information concerning SR, HR, and they're misinformed. So they come back and their perception of SR, HR or access to SR, HR is sort of distorted. So are there any strategies that you are putting in place to make sure that these players are also given adequate information, given the right information that would be helpful in pushing the agenda of equal access to SRHR services.
Thank you very much. I can answer that one.
Yeah, go ahead.
Right. We have put in place some strategies that include training and capacity building for religious leaders so that they understand the SHR issues. And we have, like I said earlier on, you may want to know that the Zimbabwe Council of Churches has, programs in Mashingo, Mat South, Harare, and Manicaland. In Erela, we also have, programs in those areas. The EFZ has also SHR programs within the various, communities they operate in. UDASISA is also doing the same thing. That is in Zimbabwe. So we have interfaith dialogues and collaborations in Zimbabwe whereby we normally talk about SRHR issues, trying to motivate each other, trying to gain access and information with regards to SRHR issues. And there's also integration of SRHR into religious education. That becomes more of a paradigm shift to sort of bring the religious leaders to some degree of awareness of what we are talking about. And we are also partnering with the Ministry of Health, as you have heard, in a wide variety of places where we are. We also have in Zimbabwe an organization that is called Zichire. That is, the Zimbabwe institution of church-related hospitals. You see, they are actually a religious organization that is also promoting SRHR issues. So that is basically what we are doing in Zimbabwe.
Okay. Thank you. Our last question from someone.
Okay, thank you so much. My question goes to the mother from the Ministry of Health. Sorry, I didn't get your name. I would love to understand how you are integrating traditional health healers in the modern health system, because I believe they're a key stakeholder, but also key culprits in actually exacerbating issues that we have. I will give an example. In Zambia, most young people that cannot access services from the health facility would rather see what you call in traditional setups. And those, if they're not well informed, will either worsen the situation or actually realize a death from that young people. So how are you ensuring that they're incorporated in the modern health system?
Yeah, good question. So I think the same way, like we've heard our religious leader speaking just now, we also have had to reach out to our traditional leaders. First of all, we acknowledge that it is part of our culture, it is part of us, the Africanness in us, to consult a traditional leader. Generally, we even start consulting a traditional leader before a health worker. So if we do not reach out to them and also get them through the same conversations that we are having even with religious leaders, we have left out at the biggest part of our populations in our interventions. So we have taken the same stance that we've also been reaching out to them, even where there are new innovations, we also incorporate them so that they get a clear understanding, and also some of the risks that are posed, and even encourage them whenever they feel that this case is probably too big, they can address some of the spiritual or give them some of the herbs. But at the end of the day, they should also be encouraging their patrons to also reach out to health facilities. A case in point generally is the STIs. It's a huge, that one is a huge one. People try as much as possible to avoid the health facility and try to get the medicines from the traditional healers. And times there is some separation, but then it's not clear. So we have had to educate them and integrate them in our outreach programs.
Thank you. I think I'll end the conversation there. Or did you want to say something? Okay.
Ndikabuda muno ndisina kuzvitaura handinzwe mushe. Ndanga ndikuda kungoti iwe nini tine basa pakuchengetedza mwana. Ngatichengetedzei vana. Ministry of Youth, Women Affairs, tobatsirana toita ma-awareness campaign kunzvimbo dzatinogara. Kuitira kuti paya patinenge tasangana tiita ma-awareness, totaura nezvevana, totaura nezvemadzimai echidiki kuti vatore ma-services avo. Ini ndine kambo kangu kandinowanzoimba kokuti panosangana maoko hapabatwe kana tichinge taungana sevabereki, sevana kumaschools tinoenda tichinotaura nezvekuti panosangana maoko hapaita sei? Panosangana maoko dairai, panosangana maoko, panosangana maoko, panosangana maoko, panosangana maoko.
She's saying where hands meet, you don't touch. Where hands meet, you don't touch. But generally, she was saying that she cannot leave the room without saying that everyone in this space has got a job to do. The Ministry of Youth, the religious leaders, the Ministry of Health, to protect the children, to protect the young people, so that they know where to access services. The young women, the young mothers access these services. Those that need to be protected are protected, and just to ensure that everyone knows the information that they need to know.
All right. So I think we have come to the end of our panel. Perhaps with just one statement you want to make about how your last statement, how can we reduce unwanted pregnancies by facilitating access to contraceptives? What is your last word about that? Final, one statement you want to make, starting from here.
As church leaders, we say young people should have their dignity and respect. They should be respected, they should be prayed for. They should be saved. Thank you.
Sema traditional leaders, tongoti bananga wani ma services, service providers, but relevant.
As traditional leaders, we're saying young people should get services from relevant stakeholders.
Okay.
Semubereki, ndiri kutaura kuti sevabereki takazara muno. Hande tinoona kuma bedrooms kwevana vedu kuti kwakamira sei. Kwete kuti kubedroom kwemwana hakupindwi. Mwana anofira imomo achiti ndiri kurwara nemusoro nyambi, mwana aora ne-STI. Saka ngatipinde mukati memabedrooms evana vedu tichiona kuti makamira sei. Ndo mune zvizhinji zvakavanzika maita basa.
As a parent, I am saying let us be aware of what our children are doing. Let's go to their bedrooms. Let's see what they have in their bedrooms. Some of our children are sick with STIs, but we'll be assuming that they've got a headache, and this will be detrimental to their health.
As a young leader, I serve as the voice of the young people to build trust in religious leaders and to framework social impact.
As someone who represents young people and leading one of the largest dreams programs for adolescent girls and young women, I would say to young people, let us try to be humble. Let's co-create our programs with the adults in the room, and let's also acknowledge the adults' role. They may not understand our issues right now, because the last time they were our age was a long time ago and a lot of things happened, but at the same time, let's acknowledge their role to redirect our moral compass, and so let us co-create our programs with them and also acknowledge their fears in their role.
Thank you. So as I was having this conversation with the gatekeepers, I was remembering my own engagement, especially with my granny. Whenever we wanted to talk an issue and I asked a direct question, my granny would want to tell a story rather than the academic exercise. So, can you explain this? And no, she will tell a story. So I'm very much aware that we have brought out gatekeepers. Maybe we as advocates, we have the language to articulate technically, and that's why we can respond quickly. But sometimes our gatekeepers, we need to engage them in a different way, and they will tend to tell stories. And it's out of those stories that we get the answer. So I am actually very grateful that we brought you into the spotlight. This is not easy to do. And we had a conversation with you, and we greatly appreciate you for actually engaging with us. Thank you so much.
We can do better to give them a round of applause. Thank you so much. I know that we are exhausted, and I have good news. The day is done. Can you turn to your neighbor? Turn to your neighbor away from your devices. Turn to your neighbor. Look at your neighbor and say, neighbor. I can't hear you. Look at your neighbor and say, neighbor. Neighbor, we did it. We ended day 2. Ask your neighbor, neighbor, how are you feeling? Neighbor respond and say, I'm feeling fine. Neighbor, please respond and say, I'm feeling fine. Hey, neighbor here is saying she's feeling exhausted. So, we are going to have any housekeeping rules from Diana, any announcements if there's any, and then we are going to conclude. But tomorrow we start again same time. Tomorrow we are going up until half day, right? Yes. Is that okay? Young people who are supposed to give us a last something, please make your way to the room so that we can conclude. If you can hear me, young people who are supposed to give us something.
Okay, so as one of the young people who are supposed to come and give you something, can I have Jeremiah, Iga, Tando, Irene, and the other team? DJ, can you play the song for us? Everyone else is allowed to join us, but
We ask that you also be upstanding and join in the dance.